For this assignment, I got to choose 4 different assessments to help our case study client out here. She is a 19-year-old soccer player preparing for her next season, and right now she has a few different knee problems. During her overhead squat assessment, she had inward caving knees, so hopefully some of these assessments will kind of help her out and kind of strengthen her whole body and kind of get everything back in order. Now, so for our first assessment, we're going to do a range of motion assessment. This is the hip external rotation assessment, and during this assessment I'm able to see a few different overactive muscles such as the adductor magnus and the TFL. So we're just going to lift your leg up here, and during this assessment we're going to just turn your foot in this way and pull your hip out this way. So during this assessment you normally use a goniometer to kind of measure the angles to check the range of motion, but this client here, she's actually really good and we won't have to worry about checking the angles because she already has a great range of motion. However, the case study client, because of the inward caving knees, she's going to have a little bit tougher time doing this and her range of motion won't be as good. So doing this kind of over time will kind of help her increase that range of motion and hopefully decrease that inward caving knees. Next, we have our strength assessment, which is the Sartorius assessment. So this one, we're just going to grab the other leg here, and we're going to pull it back here and then have it turn inwards at the same time. Now I just need you to hold it there. Good. Now we're just going to pull it back out and turn it the other way. And again, just hold it there. Perfect. You can put that back down. Now, again, my client here doesn't have any problems, but with the case study client, this will kind of help her out with the strength movements. It helps us show potential overactive muscles such as the adductor magnus and the hamstring complex, but my client here is pretty well rounded, so we don't have to worry about that. Next, we have our firing position assessment. So I'm just going to get you to turn over on your side here. So this one is the hip adduction assessment. So I'm just going to get you to bend your knee here. All right. And so during this assessment, I'm just going to have to palpate on your gluteus medius and your TFL. So during this assessment, I'm just going to get you to raise your leg here. Perfect. And then bring it back down. And then one more time. Perfect. All right. So in this assessment, you want the gluteus medius and the TFL to fire in that order specifically. Any other order or altered patterns of any muscles, then you know which ones are underactive and which ones need to be worked on a little bit more. Lastly, we got our range of motion assessment, which is the knee extension assessment. So this one is one of the underactive muscles that are being assessed, is the assessment in the hamstring complex. This assessment can help the body get used to the range of motion and should help stimulate that other underactive muscles. If this is truly an underactive muscle, then this assessment should be a lot easier, as the overactive muscles will kind of be pulling in that other direction. So we're just going to raise your leg here at 90 degrees, and then all I'll get you to do is just straighten your knee as far as you can. All right, so you can tell in this client here, she's kind of more balanced and might actually have some underactive muscles in her hamstring complex instead. Whereas the case study client, because of her overactive muscles in her hip complex, she would probably be able to straighten things a little bit better.